body in good health is our duty. Otherwise, we shall not be able to keep our mind strong and clear. These golden words were told by Buddha. Yes, today I'm going to talk about the human's health. The human health deals with many organs in a body. The most important organ is the heart. As we all know, the heart is a muscular organ. It is about the size of the fist, located just behind and slightly left of the breastbone, right here. Aren't we aware of it? Right, we are aware of it. The most important point is we all ignore our health. When we ignore our health, this leads to heart problems and other organ problems.
As we all know, there are many organs present in a body, like the brain, heart, kidneys, liver, lungs, etc. We all are aware of these organs and its functionality. Today, I'm taking your 5 minutes of time to discuss important points about the heart and hypertension. Yeah, in normal words, it's called BP. Now let's see, what is the heart? The heart is a muscular organ present in our body. As we all know, the heart pumps blood to all parts of the body, right? This blood carries oxygen and nutrients to the body. The heart has 4 chambers: the upper right and left atrium, the lower left and right ventricle. It pumps about 55 to 80 ml of blood with each beat for adults and around 25 to 85 ml per beat for children. An adult heart pumps about 6,000 to 7,500 liters of blood daily. The average adult body contains about 5/4 of blood, which continuously circulates throughout the body. Now let's see the functions of the heart. As I told you, the heart has 4 chambers. Let's see their functions. The right atrium receives blood from the veins and pumps it to the right ventricle. The right ventricle receives blood from the right atrium and it is pumped to the lungs with loaded oxygen. The left atrium receives blood from the lungs where it is loaded with oxygen and pumps it back to the left ventricle. Till now, we saw the basic functions of the heart. Now let's see what is blood pressure in simple terms. The blood pressure is a pressure of the blood within the arteries. It is produced primarily by the contract of the heart muscle. The first one is systolic pressure. Systolic pressure is measured after the heart contracts and is highest. The second one is diastolic pressure. Diastolic pressure is measured before the heart contracts and lowest. Now let's see 5 important points of the blood pressure. Point number 1. What are the symptoms of high blood pressure? Point number 2. How is high blood pressure diagnosed? Point number 3. Blood pressure readings. Point number 4. How often should blood pressure be checked? Point number 5. How is high blood pressure treated? Let's check these details. First up, we have what are the symptoms of high blood pressure. Most people who have high blood pressure do not have any symptoms. In some cases, people with high blood pressure may have a pounding feeling in the head or chest, a feeling of lightheadedness or dizziness, or maybe other signs too. Without symptoms, people with high blood pressure may go years without knowing even themselves they have the condition of high blood pressure. The second point is, how is high blood pressure diagnosed? A visit to your doctor is the only way to find out if you have high blood pressure or not. You should have a general medical checkup that includes a review of your family's medical history. Your doctor will take several blood readings. Your doctor may also use a device called the ophthalmoscope to look at the blood vessels in your eyes. Doctors can see if these vessels have thickened, narrowed, or bursted, which may be the signs of high blood pressure. Your doctor will also use a stethoscope to listen to your heart and the sound of the blood flowing through the arteries. In some cases, a chest X-ray or electrocardiogram may be needed. Point number 3. Blood pressure readings. Blood pressure readings measure the two parts of blood pressure, systolic and diastolic pressure. Systolic pressure is a force of blood flow through the arteries when the heart beats. Diastolic pressure is the force of blood flow within the blood vessels when the heart rests between the beats. We'll see more information about the systolic pressure and diastolic pressure in the next point. Point number 4. How often should blood pressure be checked? Adults should have their blood pressure checked at least once a year. According to guidelines from the American Heart Association and the American College of Cardiology, a reading below 120 by 80 mmHg is classified a normal blood pressure. Those with blood pressure reading anywhere from 120 by 80 up to 129 by 80 are classified within the category called elevated blood pressure. Hypertension is defined as a reading of 130 by 80 or higher. The classification chart right here, you can see it, right? Yes, that's called a classification chart, is based on adults aged 18 or older who are not taking high blood pressure medicines and who are not actually ill. If systolic and diastolic measurements fall into different categories, the heart category should be used to classification the person's blood pressure status. Now let's see the chart of the blood pressure. We have systolic and diastolic pressure. Systolic is higher number and diastolic is lower number. A normal blood pressure should be less than 120 and 80 or 129 by 80. Now, high blood pressure. There are two stages for high blood pressure. Stage 1, 130 by 80 to 139 by 89. Stage 2, 140 by 90 or 180 by 120. Now, you're entering the dangerous state. It's called the hypertensive crisis. If your blood pressure is higher than 180 or 120, you may have a brain clot, which leads to paralysis, stroke. Consult your doctor immediately. Now let's see the 5th point, the most important point. How is high blood pressure treated? The first course of action involves lifestyle changes, especially for people with elevated blood pressure. First one, start eating a low-fat and low-salt diet. Point 2, lose weight if you need to. Point 3, begin a regular exercise program. Walk at least 30 minutes daily. Do yoga regularly. Point 4, learn to manage stress. Point 5, if you smoke, immediately quit. Point 6, drinking alcohol is a moderation, if at all. This is about the heart function and blood pressure. Please take care of your health and take care of your family. Stay safe. Can a human live without the heart? Yes, it's possible now. Living for years without a heart is possible now. A device called the total artificial heart helps some of the sickest heart failure patients can regain function. While waiting for a human heart transplant, Stan Larkin lived 555 days without the organ at all. He had recovered from his procedure in the University of Michigan Franklin Cardiovascular Center. This is it for this video. After you watch this video, I think you'll change your lifestyle. Stay safe, stay healthy. Thank you for watching this video.